Well, thank you very much for inviting me here. It's always good to come back to the birthplace of harm reduction in the United Kingdom. My first visit here was actually back in 1987, I think, when I first met Pat. And we've travelled many a road together ever since. It was when the needle exchanges were first starting up around the UK, and there was a big one here, and I was the researcher who was brought in to sort of make some sense of what was happening. I spent a lot of my life doing academic research until I got fed up with it, and then I took on the role that Pat had had as head of the International Harm Reduction Association, so I turned to advocacy. And I stopped that about 3 or 4 years ago, and I became very interested in electronic cigarettes. So I'm really pleased in what would normally be a drugs and alcohol conference that the issue of tobacco and alternatives to tobacco are on the agenda, and thank you very much for giving me the opening slot. I look, as a sociologist, I look at electronic cigarettes as disruptive. Actually, they make tremendous opportunities, but they disrupt the way in which people think about things. And that's going to be the main theme of what I talk about today. But it seemed to me when I first came across electronic cigarettes around 2010 through 2011, that here was an obvious harm reduction solution. We've got two ways we do harm reduction: safer use and safer products. Cleaning up the products actually brings potentially huge health benefits. So coming from the harm reduction tradition, it seemed to me, well, obvious, for years there hasn't been in the tobacco field a viable, attractive, nice alternative to smoking. E-cigarettes seemed the answer, and I thought everybody would agree with me. But the more I got into this, I found that the world of tobacco control is actually more divisive, weird, strange than the world of drug policy. I mean, if you think you've got difficult people to talk to, you want to move into the tobacco control field and try to talk to some of the people there, many of whom seem to be unhampered, live lives which are sort of unhampered by sanity. So there is actually quite a long thinking about tobacco harm reduction in the UK, and a lot of it goes back to a guy called Mike Russell. Back in '76, he worked in the Addiction Research Unit, which became the National Addiction Centre, and he was the smoking researcher, helped to develop nicotine replacement therapy and so on. And he made this very simple point that smokers, that people smoke for the nicotine, but they die from the tar. And you die from the tar because when you inhale smoked tobacco, you're inhaling around 4,000 chemicals, many of which we know are toxic. So that idea he had that there might be safer forms of nicotine was very important, and that thinking continued through with the development of nicotine replacement therapy, which didn't have an easy entry into the scene. There were many people who opposed the introduction of nicotine replacement therapy, but that thinking even comes through sort of follow it through to 2007, and this very important report from the Royal College of Physicians, which actually predates thinking about electronic cigarettes, but these statements here about rebalancing the market in favour of the safest nicotine products. Harm reduction in smoking can be achieved by providing smokers with safer sources of nicotine. So there's been a tobacco harm reduction thinking within many UK smoking researchers, but until at the time these statements were made, there weren't really attractive and viable sources of safer nicotine except for snus, which is a pasteurized oral tobacco available only in Sweden. It's banned throughout the rest of the European Union, which is daft. But now there are attractive and viable sources of safer nicotine, and you'll have all seen these, and the developments of these products is taking place. It's going very quickly. There are what are called the first generation electronic cigarettes, often called cigalikes. These are preloaded, can have replaceable cartridges, but some of them can be rechargeable. But that's sort of they probably account for around 50% of the market. But there are developments in products, and there's a huge variety. In fact, the variety makes the evaluation and assessment of these products rather difficult because you've got different combinations of nicotine fluids and delivery devices. The second generation electronic cigarettes are refillable, basically, so you can have a choice of flavors and nicotine strengths. And then the third generation, often known as mods, have interchangeable parts, adjustable batteries, so you can control the voltage and the wattage to control the temperature at which the nicotine vaporizes. Now, in comparison with smoked tobacco, e-cigarettes contain propylene glycol, which some of you will be familiar with from the smoke machines in clubs. It's the same substance, so most of you will have inhaled it somewhere along the line, even if you haven't tried an e-cigarette. Nicotine in different strengths, and flavorings. And flavorings are important for a number of reasons. One is that nicotine fluid doesn't have much of a flavor, so you have to add, even if you want it to taste like tobacco, you've got to add flavorings. But many people like the range of flavors that go into e-cigarettes, and for many electronic cigarette users, the choice of flavors is actually a key part of the vaping experience, and many then don't like the tobacco flavor, and many people would vary the flavors they use during the day. So disruptive, I call it a disruptive innovation because, for the first time, consumers have got an alternative, safer source of nicotine. The other big disruptive innovation in the history of tobacco was when Bonsac invented the cigarette rolling machine in the 1880s, when for the first time you could mass produce cigarettes. And of course, at that time, cigarettes were seen as a safer, cleaner alternative to chewing tobacco and cigars and so on. So there's kind of, there's an interesting story here. But that was a huge disruption. So cigarettes replaced nearly every other form of consumption of tobacco between about 1880 and 1920. So consumers have a safer source of nicotine. For smoking and nicotine researchers, there's a whole new agenda here about who's using them, what do they like, what's in the liquids, the fluids, and so on. Tobacco companies, here you have a product coming along which undermines their business model, and we've got declines in tobacco sales. So many tobacco companies are now looking at e-cigarettes and have bought into the e-cigarette market because it's having it upsets the way they've been flogging vegetable matter wrapped in paper, stacked on shelves, and it's been easy. But selling e-cigarettes is a very different thing to that. So it upsets the public view of nicotine, because if you separate out the nasty tars and toxins from the nicotine, then is your use of nicotine itself a problem? Is addiction to a relatively harmless substance a problem? And does it begin to refocus on recreational nicotine use? So once you separate out the nasty things, you actually begin to view the drug in a new way. It's upsetting for governments and regulators because they're all asked to do something about it, and they don't necessarily always know what to do, and they don't always make good decisions about what to do. And lastly, and this is a bane of my life, that it upsets many health and tobacco control organizations who have for the last 15, 20 years had the tobacco control narrative, a very important and powerful one, which has been all about reducing, banning, getting rid of. And it seems to be very difficult for many public health people and tobacco control people to kind of turn a little corner and say, well, what happens when you've got a safer product? Where does that fit within a kind of a zero tolerance narrative for smokers and for smoking and for nicotine use? So, big surprise, rapid rise, estimated 29 million users in Europe, large market, doubling every year in the US. They work for some smokers. In the few randomized controlled trials there have been, they are at least as effective as NRT, but because they're more popular, they have a bigger population impact. RCTs are very difficult in this field because of the variation in products, product development, and RCTs are not kind of real world. The ASH, Action on Smoking and Health Survey, 2.1 million users in the UK, and they estimate 700,000 ex-smokers are using e-cigarettes. And in the only, as it were, real-world study done by Robert West and colleagues, they followed a cohort of people over time. E-cigarettes were more effective than receiving no help for switching from smoking, and more effective than, and in turn that was more effective than using over-the-counter nicotine replacement therapy. So many ex-smokers like them and prefer them to other stop-smoking aids. And this again is a slide from Robert West. Now, if you track the top line, that is over-the-counter nicotine replacement therapy, gums, patches, and so on. You can see since 2009, a few blips, but really a steady decrease in the use of over-the-counter nicotine replacement therapy. Behavioral support, which is actually a very effective way to help people stop smoking, going along in the blue line there, always been lesser available, but beginning to drop. And many people in smoking cessation clinics are now saying, hang on, what's happening and what's our job going to be? And the big rise, as you see, the green line, e-cigarettes are now the most popular aid to cessation. So they've taken over from everything else. Safe or safer, many of the arguments are around, many people try to pitch the arguments in terms of absolute safety, and that's, as a harm reductionist, that's wrong. The issue is how much safer these might be than the competing product. And most of the researchers are coming up with figures around 95, 99% safer when you look at the actual constituents of the fluids, or if you look at the constituents of the vapor, which is more important, looking at the cytotoxicity of the flavors and so on, the presence of nitrosamines, presence of heavy metals and so on. So when you look at what's in e-cigarettes compared with what's in regular cigarettes, probably 95 to 99% safer. And that's a very good review in Addiction by Hayek and colleagues. Similar statements coming out from Robert West and others. So when people say, are they safe? The question is, are they safer, and how much safer might they be? There is a continuum of risk for different nicotine-containing products. This is a graph from many of you may know the studies that David Nutt did on the harm reduction, whatever it was. How does heroin, alcohol, ecstasy, cannabis compare, expert panel type assessment. And he did this recently for different nicotine products, which range on this chart from ones that you smoke through to smokeless products, through to nicotine products. And there really is, they call it a continuum of risk, but it's really very much a cliff, because once you get away from smoking things, burning vegetable matter, the risks drop dramatically. So in this chart, what are labeled here as ENDS, which is the WHO definition, electronic nicotine delivery systems, they're down the safer end along with the NRT products. It's been a consumer-led health revolution. All this hasn't cost the taxpayer anything. It's not that the NHS is paying for this. It's not even that many public health leaders are spending their time promoting these things, because many public health leaders are spending their time trying to get rid of these things and briefing against them. It's been out of people's pockets. It's a transfer from buying cigarettes to buying a safer product. So acceptable and attractive for people who want to stop smoking, and most smokers want to stop smoking, but many smokers don't really want to give up the nicotine. So people who are unable or unwilling, and that's a language we've had in harm reduction for a long time, you can continue to use nicotine and to like using nicotine without facing the health problems from smoking tobacco. Classic harm reduction, a safer product. Classic harm reduction, very much user and consumer-led, because harm reduction is done by the people who use drugs. We promote it, we talk about it, but the people who do it are the users and consumers. It's classic public health, going back to all those sort of strident messages and the principles of public health. The Ottawa Charter, WHO Ottawa Charter, health promotion is the process of enabling people to increase control over and to improve their health. Well, people are doing that. In fact, without the instigation of public health leaders, and I think that's sometimes why public health leaders get a little bit worried about this, because they're comfortable with enabling people when they're kind of trying to exhort people to do things, but when people are getting on and doing it on their own bat, they, hang on, this is a little bit dodgy here, we might not be in control of this anymore. So it is classic public health. Some consumers, some vapers, are very highly aware of the science, the policy, the politics, and I describe it as a kind of a disorganized, individualized social movement, unlike that we've seen in drug policy reform. In that much of it is social media. There aren't many organized groups and community activist groups. And some people are saying that vapor activists are really like AIDS activists. They're shouting and arguing and wanting engagement with public health, but it's very, very disorganized. And for the first time, as a colleague of mine, Jacques Huzek, has said, stopping smoking is interesting and fun and communal in a social media sense. And this is a slide from a French Vapers Forum, which has 61,000 members and 900,000 interactions a month on the forum site. People chatting about products, chatting about, should I use this, should I use that? Have you heard about the new one of this? And also, and a bit of politics in there. A huge social media presence amongst people who, people are talking to each other about this. And you don't have websites and chat forums for people who are using NRT. Have you ever seen, latest gum, fantastic. It's just not there. Vapor activism, developing, quite very knowledgeable. Most of it's on Twitter. There are some organizations. There are about 12, 15 vaping consumer activist groups in Europe, coordinated by the European Vapers United network. Proud to Vape, e-cig saves lives. Very powerful in there was a challenge to e-cigarettes within the European Tobacco Products Directive, and the history of that is that vapers turned around that political process by the pressure they put on MEPs. It was the first time I'd seen a bit of social activism which changed a piece of legislation going through the European legislative process. Health impact. Will they overtake tobacco cigarettes as tobacco cigarettes in turn had overtaken other tobacco products? Well, stock market analysts, and I think it's quite interesting as a social scientist, a lot of the data now are coming out from stock market reports and Wells Fargo and Morgan Stanley analysts. Some of them are quite bullish about the crossover of e-cigarettes and smoked tobacco. I think they're probably a bit optimistic, but they're giving dates sort of, not going to be 2015, but they're giving dates sort of 5 to 10 years ahead. I think that's very optimistic. But there have been continued declines in tobacco cigarette sales, and also a bigger decrease in adult smoking prevalence than we've seen before. And this again is from Robert West, and it shows cigarette smoking prevalence in the UK from 2007, which is really the introductory year for e-cigs, through to September this year. And you've got extraordinarily decrease in cigarette consumption. Robert thinks that about half of this decrease is attributable to e-cigarettes, so about 0.5% per year decrease. Now, in smoking control terms, a 0.5% decrease in prevalence a year is a lot. So there's something very interesting in happening. Some people have said, well, this normalizes smoking, there'll be more smoking. Well, all the trends are in the different direction. Health impact. 80,000 people die in England each year from tobacco, and that's rather sobering when we compare that with deaths from other substances. Robert West thinks that for every 1 million smokers who switch to e-cigs, 6,000 lives could be saved. And as I indicated, this has bigger potential impact than other tobacco control measures. Big package of measures went through the European Union earlier this year, but on their estimates would only amount to a 0.5% decrease in tobacco use across Europe over 5 years. And now we're looking and seeing 0.5% per annum. Regulatory quandary, what on earth do we do about them? Well, are they medicines? Are they tobacco products? Are they consumer products? So this has been really the area in which the arguments have been. It was proposed originally in European legislation that they would be medicines only. So every product would have to go through medicines regulation, which is expensive and cumbersome. They can be medicines if a health claim is made, and this is an interesting thing about promoting e-cigs, because you can't say you can't promote them as helping people to stop smoking because that's a health claim. you can say they're a safer alternative to tobacco, but you can't claim that they help people stop smoking. If you make that claim, they're a medicine. And there's only one product which has got a provisional medicines license, and that's a product produced by Nico Ventures, which is a subsidiary of British American Tobacco. And that shows you that if you're going down a medicines route, it's the people with big purses which will make the pitch for that. But it's taken about 2 years to get a licensed product, and every little bit would, if you've got different flavors, all those would need a separate license. There's a real hindrance to product development. Are there tobacco product? Well, there is something called the WHO Framework Convention on Tobacco Control, which has been hugely important in driving. I've got 5 minutes. Oh, that's good. Hugely important in persuading countries to introduce tobacco control measures, but it's unclear whether e-cigarettes are within the purview of the convention, because the convention the definition of tobacco products in the convention doesn't clearly cover electronic cigarettes. But WHO and the countries that go to the 2 yearly meetings of the Framework Convention talk as if they do have purview over this domain. The EU says that a priori these products are not within the directive. The UK government says they're not, but nobody actually speaks up on that. Or are they a consumer product? Well, they're a consumer product now. They're actually covered by many European directives already. The new Tobacco Products Directive is, so I said, yes, a consumer product, yes, sort of, because there are within the European Tobacco Products Directive quite severe constraints on product type, product size, advertising, and so on. You've picked up that I disagree with quite a few people who disagree with me. I think that there's a real difficulty in some public health, among some public health leaders in some tobacco control organizations and within WHO about how to pitch, what is the pitch? And most of the pitch has been that there are threats from these products. Now, some of these are small, some are improbable, and some may be important. But there's a narrative within public health that these things might be a gateway to smoking, that, what about the young people? What about if young people start using e-cigarettes? What about addiction to nicotine? Does it re-normalize smoking? And you might have seen some public health people on the TV earlier this week, because the VIP product, the first one to show vape and the product, because the advertising controls changed this Monday. There were public health people saying this is bad, it looks like smoking, and I don't quite get the logic of that, because it's not smoking, it's something else. The tobacco industry is involved. We should ban it in indoor places because it undermines smoke-free legislation, toxicity, safety, important issues. There's no consideration in that narrative to the positive effects. So it's emphasizing risk without looking at the potential benefits. And I think that is actually daft science, and also I think it's probably unethical. When the WHO produced its report on e-cigs earlier in the year, it tweeted, and it is a bizarre tweet, e-cigarettes and other electronic nicotine delivery systems pose threats to public health. I mean, I think that's kind of losing the plot about the mission, which is saving lives from tobacco. So there is a narrative, and it's not only about science. We know that from drug policy reform, from harm reduction. And when I was thinking about the way in which some of the threat narrative about e-cigarettes is posed, undermines anti-smoking policy, encourages young people, prolongs smoking, delays quitting, normalizes smoking, abstinence is the best option. Those are all the kinds of things we heard, or sometimes still hear, about harm reduction, about needles and syringes, not only in this country, but in other places where it's difficult to get these into place. The harm reduction undermines anti-drugs policy, encourages young people, might encourage young people to use drugs, prolongs addiction, abstinence is the best option. And these narratives are not only in the drugs field, but you can see it also in the broader AIDS field, with when you introduce condoms into countries where condoms are not like, condoms will undermine religion or whatever. It's as though harm reduction will create social disorder and the destruction of society as we know it. So these narratives are not unknown, but unfortunately the narrative often dominates over the science. So the last slide is the harm reduction potential. Certainly there will be risks there, but a product which is so much safer than the awful cigarettes, I know probably quite a few of you in the audience, you'll be going out the front of the building in the break to have a cigarette. You should have an e-cigarette. But it's the harm reduction potential. It's maximising the public health potential, but minimising the risks. And the minimising the risks can be done fairly straightforwardly. There are perverse consequences from over-regulation in that you are putting higher controls and constraints on the safer product and often unselling it compared with cigarettes. I mean, all the regulatory thing, you get risk-averse bureaucrats who think, if we can have a standard on this, we've got to have it. But they're doing that to e-cigarettes, but you don't do it to regular cigarettes. So you're putting more constraint over e-cigarettes than over when they're competing with really nasty other products. And also, I think it's actually unethical to deny or discourage use of life-saving products. And just on the right on this final slide, there's a letter which a number of scientists wrote to WHO earlier in the year, arguing for the potential of tobacco harm reduction. So don't just consider the risks and the threats, but the potential of harm reduction, the potential of these new products as harm reduction, and probably one of the most significant health innovations in the 21st century. So thank you.